I can't even believe this. People are taking ivermectin that's intended for use in animals in order to prevent or treat COVID-19. Honestly, I couldn't make this up. I'm not making this up. Guys, it's all over the news. I don't know if you heard, the Mississippi Poison Control Center actually put out a press release because of this. They said that they are receiving an increased number of calls from people who have taken ivermectin to prevent or treat COVID, but it's not just that, by the way. That's bad enough in and of itself. We're going to talk about that. But 70% of the calls are related to ingestion of livestock or animal formulations of ivermectin that people have purchased at livestock supply stores. Guys, are you with me? So it's not the people ivermectin, and I'm going to tell you all about ivermectin so you understand what I'm talking about, but they're getting animal ivermectin from livestock stores that is intended for animals, sometimes large animals. And just so you know, the good news, by the way, of this is that according to this press release, 85% of people had mild symptoms, which is a good thing. Only one was advised to seek further care. Also, according to the press release, there were no hospitalizations that they have noted. Okay, let's break this down, okay? Let's talk about ivermectin, what it's for, what it is not. Let's first start about what ivermectin is, okay? Ivermectin is an anti-parasitic. That means it's used against parasites. It's indicated, or rather, it's been approved for use in people, but also in animals. So as a doctor, I have prescribed the people form of ivermectin to people who need it for parasitic issues. And then there's also an ivermectin that's formulated for animals. That's a different formulation because it's for a different thing. It's an animal, not a person. I don't prescribe those. I'm not a veterinarian. But you get the point, okay? For people and an animal. For people, we give it to treat parasites. And then in animals, you might recognize this as a heartworm medicine. It's a very, ivermectin is often used as prevention for heartworm in dogs and cats. It's also used for treatment of internal and external parasites in other various animals as well. Okay, so that's what ivermectin is. It's an anti-parasitic, indicated for people and animals, but different doses, different formulations, because people and animals are different. Ivermectin is not an antiviral. Guys, just so you know, and just so we remember and level set here, COVID-19 is a virus. It's not a parasite. It's a virus. And ivermectin is not an antiviral medication. But let's keep going. Furthermore, ivermectin is not approved for the prevention or treatment of COVID-19. It does not have an approval for this. It also does not have an emergency use authorization for COVID-19 either. There is no current approval for ivermectin to either prevent or treat COVID-19. That's the other thing we should take note of. And you probably say, well, why is everybody talking about ivermectin? Well, there are studies ongoing. There have been studies, and there are still studies ongoing. But honestly, we're not there yet. The data doesn't show that this should be a treatment or a prevention strategy for COVID-19, and thus it is not at this point, okay? Now, a few other things I should say. Just in general, people should not be taking animal medicines, period, okay? Why? Well, because people medications are formulated for people. Animal medications are formulated for animals. Remember that animal drugs may be and tend to be highly concentrated for animal sizes, which often are very, very large. Remember that taking an animal medication, if you're a person, which clearly you are if you're watching this video, it could do so much bad in your body. It could interfere with other medications you're taking, such as blood thinners and things like that. It can be toxic. Hello, toxicity, people. You could experience overdose symptoms such as rash, nausea, vomiting, diarrhea, abdominal pain, even things like allergic reactions, seizures, coma, even death. This is just something you don't want to do. And something else I thought was really interesting that the FDA said was that something else we have to keep in mind is that animal medications, even though it may have the same name as a people medication, oftentimes animal medications may have inactive ingredients in that formulation for the animal that has not been evaluated for use in people. So that's really, really important to note. Or those inactive ingredients might be present at higher amounts in the animal formulations than it would be in a people formulation. In other words, just leave the animal medicines alone, okay? And leave ivermectin alone, all right? Ivermectin, once again, is not FDA approved to prevent or treat COVID-19. Leave it alone. There are studies that are ongoing. We'll have to see if based on the study results, our evidence changes. But right now, no ivermectin, folks. Just wear a mask. Get your vaccine. Do all that kind of stuff. And by the way, I have to say, it's a little shocking to me that people would be willing to go to a livestock company or place to pick up a medication indicated for animals and take that when perhaps some of them might not be willing to take a vaccine. Just saying, that chance does exist. So, let's focus on the things that we know are tried and true and things that we know do work and are safe and effective. That is masking, that is social distancing, hand washing, that is getting the vaccine, that is getting the boosters when we are eligible for them. Guys, I hope this is helpful. Please write your questions below. Guys, I'm Dr. Jen Caudle. If you have not subscribed to my channel, I invite you to do so. Also, please click the little bell for updates. Comment on this video. Let me know what you think. Also, take a look in the comments for another video I did on ivermectin. Guys, I'll be back soon. I'm Dr. Jen.